Epilepsy is a condition characterized by recurrent seizures, meaning seizures that happen more than once. So what a seizure is, however, is rapid firing of cells abnormally that usually causes some kind of a sign or symptom that people recognize. Seizures can be caused by lots of different things. There are some genetic forms of epilepsy and seizures. There can be also just metabolic causes, so just electrolytes or blood sugar being out of balance can sometimes cause a single seizure. With trauma or tumors, different lesions in the brain, it can also be causes for seizure. Seizures can be managed in a patient with epilepsy when they have recurrent seizures, and there are patients that are often well controlled. The majority of patients are often well controlled on medications. Generally, you get beyond an individual being beyond 2 or 3 medications. The efficacy of adding further medications, like a 4th medication or a 5th medication to control seizures, is pretty low. And then you get into the different types of seizure surgeries that we have available to us beyond DBS as well.
DBS stands for deep brain stimulation. By stimulating parts of the brain, we can, get improvement in symptoms without being destructive. The deep brain stimulator goes into a different part of the brain, into the thalamus, which is an area that's been implicated in propagating seizures into other parts of the brain. And so while it's not totally curative, it can be very good at decreasing the incidence and the severity of seizures.
When you're talking about surgery to treat epilepsy, you're being treated at a level 4 epilepsy center, which is the highest level epilepsy center, which is what we have here at Hershey Medical Center. We have, all the technology, and we have an epilepsy surgeon and myself, and we've got lots of epileptologists, which are neurologists that focus on epilepsy treatment. So you're getting specialized treatment and care so that we can work these patients up appropriately and offer them surgical treatment.
Deep brain stimulation, no question, is proven technology, and we're at a point with deep brain stimulation that we're very familiar with it. We know how to use it. We know how to apply it in given situations. The exciting part right now is that we have a new reason to do it, and new hope really to bring to people who have these kinds of problems. We live to try and help people out and make their lives more normal, and so it's extremely exciting for us to be able to do that for another group of patients.